Hey, my name is Vaughn Brown, and today I'll be covering the Physician's Assistants Ethical Guidelines provided by the AAPA, the American Academy of Physician Assistants. The guidelines for the ethical conduct for physician's assistants are comprised of two main parts. First is the 4 bioethical principles, and secondly, a statement of values of the PA profession. The 4 bioethical principles are followed by a broad range of medical professionals, such as nurses, doctors, PAs, and dentists alike. The principles were introduced by Tom L. Beauchamp and James Childress. These two philosophers presented a framework known as principlism that organized biomedical ethics around 4 key principles: autonomy, beneficence, non-maleficence, and justice. The first bioethical principle of autonomy simply sets the standard that PAs, along with other medical professionals, should respect the personal decisions of their patients. The second principle of beneficence essentially sets the precedent that PAs should act in their patients' best interests, although it's important to note that in some cases it may be difficult to balance a patient's right to autonomy and acting in their best interests. The third principle of non-maleficence means to do no harm or cause any unnecessary burden upon your patient. Slightly different from beneficence in that one, beneficence means to essentially do the right thing, and non-maleficence is to not do the wrong thing. And finally, the principle of justice, which establishes that patients in similar circumstances receive similar care. It encourages the fair distribution of resources, risk, and cost. The second part of the PA guidelines are the statement of values for the PA profession. These values include 10 or so statements that encourage the confidentiality, the non-discrimination, and the responsibility of the health, welfare, safety, and dignity of patients. The guidelines also specify and encourage PAs to use their knowledge and experience to contribute to a healthy community, and also to expand one's own knowledge with other PAs and other PA students. If I were to summarize the nature of the PA guidelines, I would describe them as the pursuit of medical knowledge and the distribution of excellent patient care. These guidelines in general seek to encourage a positive impact on the health and well-being of PA patients. The rules are important in assisting PAs in helping their patients in their pursuit of happiness, and also make it clear what priorities PAs need to hold in high regard to create a moral culture that helps PAs understand what it takes to maintain public trust and professional integrity. In Chapter 12 of Dr. William Bennett's The Moral Compass, the practical level of ethics tends to focus on real-life decision-making, and the practical level seems to most closely resemble the nature of the guidelines for the PA profession. For example, the balance one may have to have in order to make a decision between a patient's bodily autonomy and acting in their best interests. Every rule in the guideline has a practical application. For that reason, I would describe the PA guidelines to be written in the practical level. There are numerous examples of the balance that's needed in order to distribute excellent care to patients. Unfortunately, it's very difficult to get it right every time. And unfortunately, although most of the time medical professionals have excellent intentions, the results aren't the best, to say the least. For example, recently a video went viral of a woman writhing in pain while in labor. Before the nurse could actually give care to the patient, it was necessary for paperwork to be completed first. The nurse may have wanted to give care to her patient, but clearly there were legal barriers to that. The woman ended up giving birth to a healthy baby, but the nurse is under intense scrutiny for her actions or inaction.